Good evening, everyone. Dignitaries on the dais, off the dais, fellow awardees, congratulations to all of you, young students who have passed their degrees. Congratulations to all of you. I think today is a very special day because it's not often that doctors are called to be felicitated. In fact, I think many years ago all that would have happened. Today, உதவாங்காமல் இருந்தால் சரின்ற மாதிரி people only criticize us, beat us, kill us. That is the situation that doctors are facing today for various reasons which you won't go into. But in that kind of a situation, to be honored and felicitated by two organizations which are doing great work, we are very grateful to you. Special thanks to Dr. CMK Reddy. I won't ask him his age, but he doesn't look more than 30. The way he is walking, the speed with which he walks, his phenomenal memory. Sir, continue to do the services for long time to come. What can I tell young graduates who are here? I think Dr. CMK Reddy made a plea to the Honorable Health Minister, because I have been in private practice all my life, although I studied in the government colleges, but I have always been in private practice. I think government service is great, and the government is doing a phenomenal job, but so are the private practitioners, because as he mentioned, 70 to 80% of the healthcare in India, particularly in urban areas, is rendered by private practitioners. If you remove that, there's a significant gap comes there. So in private practice, it is not a wrong thing to make money. Making money is nowhere in the Bhagavad Gita it's written, don't make money. I've searched very much. Nowhere in any religion it is mentioned, be poor, suffer, be miserable. And that's exactly what Dr. Pritikachari said, that you don't have to be miserable, you can be successful. You can be an entrepreneur. But when you have an entrepreneur, combine it with two other E's. One is ethics and the other is empathy. Never forget your empathy. Dr. CMK Reddy mentioned why we are getting sued. It's because we are not empathetic to our patients. We don't care for them. If we really care for them, do you think any patient will sue you? Still now, touch wood, I have not had a single case against me in my entire life. And it's only because we show that we care for patients. And along with that, ethics also. There are a lot of ways of making money. You can make through shortcuts, if you make money through shortcuts, you will not last long. Somewhere along the line, you will make a mistake. So be honest, work hard, have passion. The other thing which is missing in the medical profession, as a medical scientist myself, is academics. Most people study very hard, they get their degree, and then they forget all about medicine. Remember that 5 years from today, medicine or surgery is very different from what it is today. It is continuously evolving. If you don't study, you will get outdated. And somebody is going to do better than you, and could be another reason why you get sued, because you didn't do what should have been done on that day. What we do today is right today. But 5 years later, you should have done something else. If you don't do that, there is also a medical negligence. And that brings me to the last point of research. Very little research is done by medical doctors today. I don't blame them because they are not trained in research. Right from the undergraduate days, if we sprinkle a little research, that interest for research, I think it will grow like a big tree, and then you can't stop it. The fire in the belly will continue. It may not be huge research is doing, maybe a case report, something interesting. Read about it, write about it, document it, because 10 other people might have had the same problem that you had. And now you are serving people by documenting what you have done. Start in that way, and you keep up that interest, you will find that medicine then becomes very interesting. Otherwise, it can become very stale. So all the youngsters, wish you all the very best. I'd like to see people who are sitting here one day come up here and get this award from LIMRA and from TAMPA. Thank you and wish you all the very best, and God bless you all.